My name's Alison Page. I'm a non-executive director on the board of Leeds Teaching Hospital NHS Trust, and I'm also a senior partner at DLA Piper, which is one of the world's largest law firms, and indeed our second largest office in the world is based in the city of Leeds, where I lead the banking and infrastructure practice. As part of my role at Leeds Teaching Hospital, I sit on the Audit Committee and the Quality Committee, and I'm also involved in the Commercial Group, where one of the huge projects we have been undertaking is looking in detail at the regeneration of the LGI scheme and the importance that that could have for the entire city, and in particular, of course, our hospital and our relationship with the University of Leeds.
Hello, my name is Bill Kirkup. I'm a non-executive director at the Trust. I was formerly a medical doctor working in obs and gynae and then in public health, and I retired from the Department of Health at the end of 2009. I'm part of the board of the Trust. My particular responsibility is working on quality and quality improvement. A non-executive director is a part of the board structure of an organisation, in this case the Trust here. And the non-executive's job is not to be an executive, not to run things managerially, but to hold the executive to account, to challenge them, to make sure that they're doing their jobs robustly. I take a particular responsibility for quality. I chair the Quality Assurance Committee, and we are looking to make sure that all of the processes and systems that are in the Trust to make sure that quality is improved and safety is maintained are functioning properly. I think clinical quality is absolutely at the heart of what we do, and I think that this is one of the most important roles that we have. If we're not keeping clinical quality high, then we're not doing the proper job. I'm really pleased to have this opportunity because improving quality and safety has been at the heart of what I've wanted to do for a long time now, and it's great to be able to do that in a trust like this, working a bit nearer to the sharp end where services are actually delivered to make things better.
Okay, my name is Carl Chambers. I'm one of the non-executive directors here at the Trust. By background, I'm a barrister and chartered accountant. I've been involved in businesses in Yorkshire for the last 20 years. As well as my role at the hospital, I'm also currently chairman of a large gas supply business in Yorkshire. My role at the Trust, I sit on the Audit Committee, which looks at the processes we have for controlling the way the Trust is run and making sure processes are in place. I also chair the Finance and Performance Committee, which effectively looks at the financial systems across the Trust to make sure we have systems and controls that account for our use of the money we get, that we spend it wisely, and that our performance is in line with National Health Service constitutional standards. And our role is effectively to ensure those systems are in place, to understand what goes on, and to be a critical friend to the management team, to challenge some assumptions, and to help support the board in its overall role, both in terms of day-to-day operations, but also its overall medium and long-term strategy.
Hello, my name is Caroline Johnston, and I'm the Deputy Chair and Chair of Audit, and I'm a non-executive director of the Trust Board of Leeds Teaching Hospitals Trust. I have been on the board now for 3.5 years. I joined the board in January 2013, and I've seen a huge amount of change in the time that I have been on the board, as Julian and the team have joined, and we've rolled out the Leeds Way, which touches every aspect of all our lives. The board is there to work for the patients, for the staff, and for the community to make sure that we're really doing the best job we possibly can to deliver the best services to the people of Leeds and the community surrounding us. My role on the Audit Committee is to really look at the risks that we have as an organisation, and to make sure that we're approaching those in the correct and proper way, and to work with the management team to think about how we can do things better across the organisation to provide good governance for the board as a whole. And of course, as an audit committee, we look at the annual accounts and we look at the reporting of the Trust to the outside world. As a member of the board, I'm involved in lots of other things. So I chair a number of the committees where we interview new doctors, which is a really interesting part of the role, where we get to meet people from right across all of the CSUs. We also on a regular basis do ward walk rounds. So for me, that's one of the best parts of this role, where I get to meet both patients but also so many of the staff, and get to hear what it's like working on a ward, working in a busy A&E department, and we can really understand how as a board we can help to support everyone.
Hi, I'm Mark Chamberlain, and I'm one of the non-exec directors of Leeds Teaching Hospitals NHS Trust. I've been a non-exec director for 6 years, and they've been 6 very exciting and very interesting years. Outside of this hospital, I used to be an HR director at BT and was for many years, and I now run my own consultancy business where I do work in the health sector, but also the IT and computing space as well. However, I really enjoy the non-exec director role here. I think particularly from my perspective, being able to connect with patients and the staff in the trust, really being able to make a difference to people's lives by being part of something that is really making such a difference to people's health and well-being is really, really important to me, and I get a real buzz out of that. My role as a non-exec covers a number of things. Now, obviously, there's the fairly clear bit, which is going to board meetings and sitting there and being part of the most senior decision-making body in the hospital. And that's really, really important. But there are other things too. So, for example, I sit as part of the Quality Assurance Committee. The role of that group is to make sure that we provide excellent and safe care to our patients. It's something I really get very enthused about. It's very, very important to us as a trust, and I enjoy attending those meetings and making those decisions. I particularly enjoy understanding some of the really leading edge things that we do in the trust. So some of the more advanced surgical procedures, techniques, some of the technology that we use, which really is leading edge in Leeds Teaching Hospitals, and I feel very proud to be part of that. And I feel very proud to have seen some of the great stuff that we can do. One of the things that I tend to take a lead interest in for the Trust is whistleblowing, which is a really important issue for us in the NHS. We really want to know if things are not going well in our organisation so that we can fix them. That's why we've got a whistleblowing policy in place that encourages people to speak up if there are problems, if there are issues that they think are not as they should be, and particularly if there are things happening which might cause patient harm. We're really, really keen as an organisation to hear about those things and to make sure that we fix them before they become an issue and before they cause any concern or harm to any of our patients. So whistleblowing is very, very important.
Hello, my name's Mark Ellaby. I'm a non-executive director of the Trust. My primary role is to work with the executive directors, looking at the performance of the Trust and holding the executive directors to account. I also sit on the Financial and Planning Committee, looking at the operational performance of the Trust. And given my background, which is working in healthcare for over 20 years, looking at opportunities where the Trust can deliver commercial solutions and hopefully deliver financial performance to the bottom line. My background, as I said, is in healthcare. For 20 some years, I've been involved in providing healthcare. I no longer do that role now. Primarily looking after elderly, both in their own homes, but also in care homes, both in this country and overseas. So I have good experience of multi-site management. We actually had 450 locations, both, as I say, in this country, in Spain and in Australia. Few more locations than the Trust, but actually hopefully working in a similar vein and able to help some of our colleagues here looking at estates issues as well.
Hello, my name is Paul Stewart and I'm a non-executive director of Leeds Teaching Hospitals NHS Trust. It's a great pleasure to serve that role. It's one that I certainly cherish, but also one that I take with great seriousness. The role of a non-executive here is very much to be supportive of the executive directors in making what are at times very difficult and challenging decisions, but also to put the appropriate degree of challenge and questioning to not only that decision making, but also the future strategy of the hospital in going forward. My day job involves, actually, I'm still a practicing doctor. I'm a Yorkshireman that went north. I trained in Edinburgh Medical School, did my postgraduate training largely in the Midlands, but also overseas in Dallas, and came to Leeds 3 years ago as the Dean of the Medical School and then the Dean of the Faculty of Medicine and Health. One of the largest, actually, faculties in the UK, employing around about 1,300 staff and with an annual budget of about 140 million. And certainly my day job outside clinical practice very much involves capacity building tomorrow's NHS with the very, very best doctors, nurses and allied health professionals, as well as, of course, doing pioneering research, world-leading medical research that we know is coming back to enhance the lives of patients locally, regionally and nationally. And that to me is one of the great attributes, I think, of the Leeds way in going forward, that very strong, passionate commitment to being the very best for research, education and training. Because we know very strong evidence base that if you either as a patient or you as an organisation are involved in clinical research, then patient quality is better. And that's at the very core of what we do here at LTHT. So in many ways, the role that I have at the university leading that pipeline, as well as at the Trust in terms of seeing the tangible benefits of the delivery of that is not only great personal satisfaction to me, but also very important for the organisations in moving forward. Thank you.